Welcome. Welcome to the virtual community resource fair here in Local District Central. We are so happy to have you this morning here in this virtual space with us. We want to be able to share with you a lot of resources that are available to you and your family. And again, we are so excited to have you here. My name is Christina Ramaya, and I am part of the Kindergarten Readiness team of Local District Central. So I'm going to go ahead and let you know a little bit of logistics. On the next slide, we want to let you know that we have interpretation available. Bienvenidos a todos. Si desean escuchar la sesión en español, pueden primer el globo abajo para escoger español. So you can listen to the audio in Spanish if you choose. Also wanted to let you know that we have our session available with subtitles. If you choose to have closed captions on your screen, you can go to the bottom of your screen where it says live transcript is available and choose closed captions, subtitles on the bottom. For today's session, as it is a webinar, if you have questions, we're going to ask that you go ahead and put them in the Q&A. We have monitors that will be providing answers to your questions that you post in the question box. When your questions are answered, they'll be viewable to the audience as well. Okay, thank you so much. So for today, we're going to start with a welcome from Ms. Baez, our Superintendent of Local District Central. We have an amazing keynote speaker, Andrew Ramirez, who's going to share some self-care tips for families. I know I need some. And I'll share a little bit about our Kindergarten Readiness Program. And then we will spend the bulk of our time with organization representatives sharing the specific resources that are available to you and your families. And then we'll close it off by representative of our wellness programs in LAUSD, Vivian de la Rosa. So with that, I'd like to hand off to Frances Baez, our superintendent. Ms. Baez, welcome.
Thank you very much, Ms. Ramaya. It is a pleasure to be with everybody this beautiful fall Saturday morning. Buenos días. Es un orgullo estar con todos ustedes aquí hoy en este día de otoño, este sábado. My name is Frances Baez, Superintendent in Local District Central, the home of the champions. And it is our champion mentality that is inspiring us. And we're inspired by our LA teams. And my Dodger background here is the inspiration for that champion teamwork to present today's resource fair. So thank you for being here to learn about the resources available to you and your families to reach wellness during these times. The wellness of our kindergarten students is important to all of us and to all of our families and all of their siblings and our school community in LA Unified and Local District Central. This fall, we reopened our doors to our students in kindergarten and to all of our students. And it was a pleasure to roll out the red carpet to the high school graduating class of 2033. Can you imagine our kinder students will be graduating in 2033? And we recognize that in order to help them achieve college and career readiness, we need to provide them with as much support and with as much access for them to be successful to reach their dreams. The Kindergarten Readiness team here in Local District Central and the LA Unified Wellness Specialists have a very informative program prepared for you so that the resources here can be accessed at any time, whenever you need them, or to share with someone you know who needs these supports from wellness, supports to with counseling, or any kinds of support will be available, and informations are available here today. I want to thank the leadership of Ms. Christina Ramaya and the leaders in Local District Central who work tirelessly to connect community resources to families in our schools, and we will continue to do that. We're excited also to report that since we reopened and since the Board of Education adopted an employee vaccination program, that almost 100% of our school administrators and teachers have been vaccinated. So as we continue to evolve in this pandemic, we reached a place where vaccinations were going to be very, very vital to ensure that our families and communities are safe, because we know that COVID is real and it has created a very big impact, and we've lost loved ones, and particularly the most vulnerable populations have been impacted. And so we want to keep them safe. By us keeping ourselves safe, they are safe. And we want to celebrate the holidays today with family, and doing that in the safest way is through this vaccination. We will continue to expand our efforts to offer the vaccination to all of our eligible students, so that every single moment that this pandemic is evolving, we're prepared, because our schools remaining open is very important. Our schools are a very important place in the community. They're the oasis. They're the place to find peace and comfort and consistency. Just recently, there was an incident that occurred near 3 of our schools in local district central. It was something that occurred in the dawn hours. And so it could have potentially affected our schools opening that day at 8 o'clock. But we all worked tirelessly to ensure that our schools remain open. And while the matter was getting resolved in our neighborhoods, when you open the doors to the main office and you see our office staff and you see our principal and you see that we are working to look at our students' data to ensure that they have tutoring and access to learning, it just felt that we were there in support of our school community. Despite whatever challenges come our way, we're going to be there to support our families and community and stay super laser-like focused on ensuring that our students reach numeracy and literacy outcomes, so that they can graduate prepared for the future and what's ahead for our society. Because we want to live in a peaceful world where we have opportunity and access for all. So with that said, now I'm going to hand the microphone back over to our kindergarten readiness teams. Thank you so much for all that you're doing. Ms. Cristina Ramaya, I'm handing the mic back to you. Thank you.
Thank you so much, Ms. Baez. We really appreciate your support as always. I know we're having a little bit of technical difficulties with our translation at this point. Ms. Marisol, there's some difficulties with your audio, so perhaps Ms. Lomeli can assist at this time while we figure out how to fix your audio. So disculpe que hay unos problemas con la de la interpretación. So estamos tratando de arreglarla. Gracias para su paciencia. Okay. So with that, I'm going to go ahead and introduce our keynote speaker, Mr. Andrew Ramirez. Mr. Andrew Ramirez is one of our family's members here in LA Unified, and we are so happy to have him here join us. He is a father of 5 and also a brother, a son, and he has some amazing stories that we can connect with, and we so appreciate him spending his Saturday with us. So Andrew, I'm going to go ahead and hand off to you, sir, and you let us know if you need us to share the slides or if you'd rather us have the screen all you.
Yes, if you can please take the slides down so I could just have a nice conversation with all of the parents. Welcome everybody to the fall festival here that they're having. Bienvenidos a toda la familia que ha venido a compartir en este evento tan especial para todos. My name is Andrew Ramirez, and I just want to have a conversation with you today. You know, the song that came on right when we came into this event was "Today's going to be a lovely day" or something like that. And when I think about a lovely day, I think about summer and I think about vacation. You know, we just came out of summer and we're in fall, but let me ask you this question. How many of you already feel like you need a vacation? I want you to think for a moment about that concept of vacation. And I want you, as we progress through today, just to sit back and relax and to think about a few things. When I think about a vacation, I think about time with my family, a good time with friends. And most often when we go on vacation, we jump on a plane, right? We jump on a plane. And if you've ever been on a plane before, you know that it's kind of crowded and you get on the plane and you go on your seat and you sit down, they close the doors, and then they do all the announcements. And then sooner or later, over the loudspeaker, you hear a ding, bloom, and there's an announcement that's made. Today, we're going to be traveling at a height of 30,000 feet. Should we experience some turbulence throughout our flight today, a mask is going to drop. Now I'm going to ask you, I've asked that the chat be open for all of you while I'm talking, because I love to interact. I can't see your faces. You can see mine, but I can't see you. And I love to interact with people. Let me ask you, for those of you who have ever been on a plane and heard that announcement before, boom, when the mask comes down, what do they tell you to do first? If you can write that in the chat box real quickly, what do they ask you to do first? And I'm not seeing it, so I'll just give the answer. They say, make sure that before you put on that mask, that oxygen mask, or before you help anybody else, should we experience prayer? Yes, to put the mask on yourself first. Thank you, Robin. Thank you, Mindy. Yes, thank you. Thank you so very much. Galaxy or Robin. Yes, they ask you to put on your mask first. Who can tell me why they ask you to put on your mask first? And why? Because there's a little bit of a delay here. I'm just going to continue on here. Okay. The reason they ask you to put on your mask first is because if you can't take care of yourself first, if you're not breathing, if you're not conscious, if you're not coherent, then you can't take care of the children or the adults. So they say, always put on your mask first before you help the children and before you help the elders. And so the message I want to put across to you today is simply this. You're on a plane, folks. We're going for a ride. And I want you to remember that self-care, the reason that we're here today to talk about health and wellness and mental well-being is because self-care starts with you. So as we progress through today's conversation, I want you just to for a moment, just put yourself in that seat of being able to be here for you first, before you think about your children and anybody else, because when you're serving yourself, you'll be able to serve them better. And if you do that, if you have an open mind about all that you're going to hear today from some amazing people who have some amazing resources that the district has brought to you, then you're going to learn a few things of how you're going to be able to protect yourself and your children from these woes of anxiety and depression and all these different things that we have going on that are running rampant, not only in our schools, but in our homes and our societies today. As we all know, COVID was a tough year. Last year was a year of unprecedented documentation, or whatever you want to call it. We all felt it. We all felt it. And we're starting to transition back, and I'm going to say transition back to what a lot of us might hope for is the normal. But there's a new normal. And as we transition, I want you to think about, why was this COVID given to us? Was it an opportunity? Was it a fluke? What was it? I always look to nature to find answers. If I allow my garden to overgrow with weeds, then the beautiful plants will die. So I looked to Mother Nature last year and I said, was COVID a curse or was it a gift? And I looked at it at both perspectives. My family, we lost some loved ones very close to us. And it was difficult. And I'm sure some of you did as well. And on the other side of it, I say, okay, we had some bad. How can we take from the good? What can we learn from this gift that was given to us of COVID? Why did nature give this to us? So I want you to think about these three things that happened during COVID. One, it attacked the lungs. That was like one of the most devastating effects of COVID, is that it attacked the lungs. Now, what is that representative of? How many of you feel that you're so overwhelmed and overworked and expected to do all these things that you can't breathe? You know, the rainforest is likened to the lungs of the world. But as parents, We're the lungs of the world, raising the new lungs of the world, which are the children. How many of us couldn't breathe? So last year, nature shut down the world to give us a moment to come back home and just be able to breathe for a moment. The second thing I want you to think about is, what do we have to do now? And I don't have it, but we have to wear these nasty old masks around everywhere as a result of COVID. So what is nature trying to tell us? What is the weed that is in our garden right now? Let me ask you this. How many of you wear a mask every day, pretending to be someone you think you're supposed to be? Living a life that maybe somebody else wanted you to live, being in a career to satisfy somebody else's needs, talking in a way that satisfies somebody else's desires for you so you're not judged or looked upon bad. How many of us wear masks every day, and now we're forced, because of COVID, to wear this mask? And let it help us recognize that all we want to do now is just be able to take off that mask. So I want all of you, as you go through today, just take off your mask and be yourself. Number 3 that we learned from COVID: social distancing. It was March and April of last year that I spent my entire lifetime, it felt like, in my home with my wife and my 5 children. And I wasn't able to go hang out with friends and family. I'm a very social person, as you can probably imagine, sitting here talking, I'm just enjoying this stuff. And I was pulled away from this most important need that I had in my life, which is community. How many of you long to have your community? How many of you missed having your community? How many of you, now that we are opening back up somewhat, appreciate your community so much more than ever before? I connected with friends and cousins during COVID that I hadn't talked to in years, and now we talk all the time, because when it's removed from you by something like COVID, you get to appreciate it more. So appreciate those things, those 3 simple things. Breathe every day, take off your masks, and get around your community. And I want you to think about something. This is kind of crazy, because last year, when people were trying to deal with this whole concept of COVID and this whole idea of self-care, which is kind of the theme of what we're talking about today, this mental and emotional wellness, it's interesting that alcohol sales, according to Nielsen, which is a very famous survey tracker, said that alcohol sales went up by 54%. And online sales went up by 262%, which means that alcohol consumption went through the roof. So people were trying to deal with the stress and anxiety and all of the challenges that they had in the only way that they knew how to, with alcohol. And so that leads me to believe that people really had a desire to address the issue that they were feeling, this stress and anxiety, this feeling distance from your families. But today we're going to talk about much better resources than alcohol. You're going to hear from a bunch of people later on today that are going to give you so many different tools and resources that are actually going to help you rather than hurt you, like alcohol might. And as you think through that, I want you to think of one thing. I want you to remember this. You don't have to have all of the answers. Let's take the LAUSD, what they're doing right here in this fall festival for you. Why did they invite me? Why didn't they invite all of the other speakers that are going to be here today? They invited us because they don't have all the answers. But inside of here, you're going to be able to find some answers. So allow yourself that space and that grace to say, I know my parents, my children are coming to me. I know they're going to school. I know I have to ask, but I don't have to have all the answers. All I have to do is be able to know where to find them. And today, that's precisely what we're going to do. Because as a father of 5, I have 5 daughters. My kids, my wife, my family comes to me for things. And I know what it's like to stress out over the challenges of, I need this and I need that, and not knowing where to go. And one kid has one problem and another has another. And it's like, well, how do I help this kid? This one is so well behaved, but this one needs a lot of love. And this one has a little bit more of attention. They need help with math. And this one doesn't read well. And it's like, where do I find all the time and resources to do all of this? It's in the community. To be able to find the resources within your community. Also remember that as a community, you don't have to do this all alone. I'm here. All of the teachers and administrators from your school district are here. All of the presenters are here today to be able to help you, because we love our children and we love our parents, and we love that we want to make a difference in the world. And we love that you're here live with us today, showing your support, not only for us, but for you to find the answers that you need. So you don't have to do it all alone. And it really can be simple. I want you to think about this. Who can finish this sentence? An apple a day. What? An apple a day keeps what? Who can write that inside of the chat box for me? Come on now. An apple a day what? Yes, an apple a day. Thank you, Robin. An apple a day keeps the doctor away. So what is that telling us? What does that saying really mean? That saying means if you just do one healthy thing a day, over the course of time, it'll build longevity. You know, Ms. Baez in the beginning said, you know, we're talking about the Dodgers and the teams, and I'm a Dodger fan, so I was so excited about that. And over the course of the last week, you've seen the Dodgers play, if you're a Dodger fan. And some of us, you watch the players and they want to hit home runs. They want to hit home runs. And we want that grand slam, right? The grand slam that where it's 4 runs in one shot, okay? But if you've seen the games have been won by 1 run. And how do you get runs? In order to get a grand slam, you have to have hits. You have to have 4 people on base. So I want you to think about this concept. Forget about hitting home runs when it comes to self-care and wellness and all that stuff. Like just an apple a day, just 1 hit a day, and you'll have a grand slam in your mental, emotional, spiritual health. Okay? And I want to share with you a few things that why all of this matters. There are 4 different levels and that touch everybody's lives. And the media and the market, and they have made millions and millions of dollars of knowing this about you and knowing about me. But I wanted to bring it to the forefront so that you understand what this is. There are 4 levels of your life that are impacted. It's your family, your finances, your fitness, and your faith. Anything you buy, anything you read, anything you desire always touches those 4 areas. So if you improve one area, you will subsequently improve another area. But if you neglect another area, then another will be neglected. So let's take that alcohol example. What happens when people buy alcohol during COVID? Okay, their health goes down, but they're also spending money. And then a lot of times, most of the times, fights in families happen when you're drinking alcohol. So not only is your family life getting messed up because you're drinking, but your finances are getting messed up because you're spending crazy money, and your health is being messed up because you're too tired the next morning to get up and go exercise. And then, so you have to recognize how everything impacts. So if you take this concept of 1 a day, this concept of 1 thing a day, then you are going to have that home run, which we call self-help. And I want to share with you just 4 quick things that keep me in balance every single day to keep my mental health at ease. And it's just a simple routine that can take 10 to 20 minutes a day. And it impacts every area of my life. Read, run, write, reflect, impacts family, faith, finances, and fun. So remember, in the first thing in the morning, what I do is I get up and I read, or excuse me, I run, I exercise. So I can get all of the stress out of my body, out of my mind. Like working out, sweating, gets all that stuff off of my shoulders, and it makes me feel good. So I start to empty out this vessel of a man that's Andrew, right? And then I write and write to get all of the craziness out that's inside of my mind out. Every day I get up and I write and write. What do I write? Doesn't matter. Just stuff that's on my mind. Now that I've emptied my vessel through running and writing, I'll sit down and I'll reflect, or I'll pray, whatever you call it. I'll meditate to allow the voice to speak to me, to tell me what is my calling, what is my purpose for that day. So I can take in the energy that is coming to me and through me. And then finally, I'll read. The vessel's empty, so I read and I fill myself with knowledge so that I can change and be better. So I want you just to consider for a moment how simple this can be, okay? To take 4 things in your life, family, finances, fitness, and faith, and impact them through a very simple routine, which is read, run, write, reflect. I'm going to make a resource available to you all in a little bit, but I want you to remember as we start to come to a close through this, that this doesn't have to be difficult. And self-care starts with you. So as you progress through today's conversations, today's talks, all of the presenters today, I want you just to commit to doing one thing. Okay, I'm going to give you one resource. If that's the one thing, take action on that. There's going to be other people giving resources. Just pick one. Don't get overwhelmed. And if you do, you'll be able to care not only for yourself, but for your children, so they don't have to experience, at least at the level that's going on now, all of the stress and anxiety and depression that everybody is feeling and going through right now. Because there is hope. That's why I wear this shirt. Be kind to yourself so that you can be kind to others. And this last thing that I wanted to share with you is that if you're hoping that we could return to the new normal, just know that this that we're living in now, this is the new normal. So this is going to be our vacation going now. We're going to get on a plane and we are going somewhere. Whether it's in this transitional phase of COVID, we don't know where we're going, but here's one thing that you have to know, that there is going to be turbulence. It's not going to be smooth. It was never meant to be smooth. The one thing that is certain is change. And the question is, are you willing to be open to that change? So when the turbulence comes, ladies and gentlemen, when the mask falls, I want you to remember this very simple thing. Put the mask on yourself first before you put it on anybody else. And if you do that, then you'll be able to take care of not only yourself, but your children, your family, your friends, and your community. Thank you very much. Christina, I don't know if we have questions or what we're doing at this point.
Thank you, Andrew. We so appreciate your words of wisdom, the reminders for self-care, how important that is for all of us. And I want to highlight something that you brought up as far as the masks, right? We're talking about masks in many different ways. I mean, there's the literal mask to protect ourselves and protect our families when we're out in the public. And that by all means, we're advocating to wear your masks, right? But then you also spoke of the metaphorical mask, the mask that we wear to protect ourselves or to do what we need to do to get through the day. So I just want to highlight that there's several different masks we're talking about, and also the mask of self-care, that oxygen mask. how we have to remember to take care of ourselves so we can be present for those that we love and support. And so thank you so much, Andrew, for your words. And let's go ahead and share the screen, because you mentioned that you have a resource for our families that will also be available to all of our families in LAUSD. Andrew, would you like to speak to it for 1 minute, please?
Sorry about that. Yeah, so this morning, as I was just going to do the talk, and I felt called to provide something to families that would help them. I know that you're busy. I know that you have a lot going on. I know that you're overwhelmed. And this is something that I teach in my business. This is something I teach to my students. When you're in the case of overwhelm and you don't know, you don't feel like you have time and you don't feel like you have the resources. It's a very simple training resource that I put together for people so that you can get some clarity, calmness, and peace of mind in your life. It really touches on those 4 F's and those 4 R's I talked about a little bit, but it goes a little bit in depth more and shows you how to use that. So at the end of it, you as a person can feel grounded and centered so that you can serve your family and your communities better. That's about a minute. So I made that available to everybody. There's no charge for it. The resource will be available next week, the 23rd, after the second fall summit or whatever you guys are having here. Yes. So that's it.
Thank you so much. And just a shout out, someone in the audience said you should have a TED Talk, and they feel your spirit and energy. So
thank you. I actually did a TED Talk in 2013. I got to do another one.
Wonderful. Yes, absolutely. So thank you again, Andrew. We really appreciate your time and looking forward to learning more of the tips that you have. I know I need to remind myself of these as well.
Thank you, Cristina. Thank you. Gracias a todos. Tengan buen día. Thank you.
Have a great day. Thank you. Okay, so we're going to move on in our agenda. And just to let you all know that all of the resources that Andrew referred to, we will have available in a resource document. In fact, if we can also share that resource document in the chat so that you can see all of the information that will be available to you after our session is over today as well. Okay, so I'm going to talk just briefly about the Kindergarten Readiness Program. On the next slide, what you'll see is our organization works with the families and the teachers and students and administrators across LA Unified. In Local District Central, for example, we have collected information about the readiness of our children, readiness for kindergarten, of over 9,000 children in Local District Central. And in that, not only are we looking at readiness in the areas of academics, but also physical health and well-being. And you'll notice that more than half of the data is around emotional maturity and social competence, because we know that being ready for school, when we enter kindergarten, the more ready we are, the more ready we are for life in general, right? So these are the areas that we look at in preparing our children and supporting over their academic years. On the next slide, to give you a little bit of information, is when the data is reported, it provides us with a snapshot of the community and what resources may be available within the community that promote the healthy development of children. So what we know on the following slide is that every community and neighborhood is different. Each community has opportunities that promote healthy development as well as possible challenges. So on the resource document that we are providing for you, on the next slide, you will see a map. There's a live interactive map of the early development instrument data. But what I want to especially highlight for you today is that with this map, you are able to choose community assets or community resources that are available for you. So you can choose and see which mental health facilities are in your neighborhood? Where might there be a food bank? Where might there be housing or shelter if you are in need? Where are there libraries or green spaces to play? So this is a very valuable resource that will be available to you on the resource document. But we also wanted to highlight very specific community resources with the organizations that we asked to come today to share with you. As Andrew mentioned, we're not in this alone. And we, as representatives of Los Angeles Unified, don't have all the answers, but we do have several departments and groups within our organization that have resources to support you and your families. So we've asked LA Unified representatives to come share their services with you, as well as outside organizations. So with that, I'm going to hand off to Ricardo Lopez, our organizational facilitator for Local District Central, who will be sharing and introducing each of our speakers for today. Welcome, Ricardo.
Thank you. Good morning, everyone. Before we get started, we want to give a good big morning welcome, bright Saturday welcome to everyone that's here. So on behalf of Wellness Programs from LAUSD, we want to extend our gratitude to everyone that's here, every family member, every student, staff, community member. Thank you for joining us this morning. And we also want to extend a big appreciation and thank you to our community partners who are taking time today from their schedule. They might be with their family members, but they opted to be here with us today to share some valuable resources. Again, along this theme of self-care, we're hoping that these resources are valuable to you, your family, friends, and other community members. By all means, soak this information in and also share it with other people. What's going to happen over the next 9 presentations, each presenter is going to share valuable resources, and some of them may overlap and some of the services may be different. They're all going to present for about 5 minutes, and thereafter or during the presentation, please feel free to ask questions. We want questions so we know what resources you need, or the resource that's being shared might be valuable to you and you need to find someone within that organization. So by all means, we encourage you to drop questions in the Q&A and also in the chat. We'll be monitoring that throughout the presentations. So with that, let's welcome our first presenter from LAUSD, and that would be Teresa Hernandez, Healthy Start Coordinator. Thank you, Teresa.
Thank you, Ricardo. Good morning to all. Thank you for joining us this beautiful morning. Thank you to the Kindergarten Readiness Program and the Local District Central teams for having our program here today. My name's Teresa Hernandez, and I'm a Student and Family Resources Coordinator in Local District Central. Next. Healthy Start is a program committed to removing barriers to school success by leveraging community partnerships which provide services and resources that meet the unique needs of our families. Next. A resource referral and follow-up assistance program that connects students and families to the resources needed most. We strive to create partnerships to meet identified needs, such as academic support and tutoring, basic needs, food, shelter, clothing, legal assistance, and medical, dental, and vision services, free or at low cost, and mental health services. Next. We are also certified enrollment counselors for health insurance and can provide assistance with enrollment for Covered California and Medi-Cal, and we work closely with and consult with CHAMP's staff. Our services are free. Next. If you should need help, please feel free to call our Student and Family Wellness Hotline at 213-241-3840, option 1. We are available Monday through Friday from 8 to 5, and you can also visit us at healthystart@lausd.net. Here's my contact information. You can reach me by email, my Google number. I work from 8 to 4:30, and I am available Monday through Friday. Thank you so much for having me here, and we look forward to being of service to you. Thank you.
Thank you, Teresa. We appreciate the information.
Thank you.
Our next presenter is Marisela Zurita. She's a healthcare advocate representing LAUSD CHAMP program.
Good morning, everyone. My name is Marisela. I'm with the CHAMP program, also known as the Children Health Access and Medical Program. Next. CHAMP supports students' academic achievement and promotes wellness by enrolling children, their families, and the community into health insurance programs. When we mean the community, it means that we help people that are non-LAUSD as well. CHAMP staff are certified enrollment counselors who specialize in Medi-Cal and cover California enrollment and troubleshooting. Next slide. Part of the CHAMP program, some of the research that we do are enrollment and renewals. When we mean renewals, we assist renewal for Cover California Medical to ensure that families continue being enrolled and their benefits are not terminated at the end of the year. We also do presentations to educate what type of access they have within the programs that they apply for or that they might qualify for. When speaking with the family, we also do referrals outside of the LAUSD, maybe community partners or programs that are available within the LA County. Next slide. Part of the program also, we educate our families knowing what they're eligible for within the program. Some individuals don't know that they have access to mental health, to prescription medication, to substance abuse assistance. So our program educates into the 10 essential benefits that the insurance offers to the clients. Next slide. So some important dates to know within the programs. Some of the programs that we have to know within Cover California are open enrollment. It's ongoing for this year due to the American Rescue Plan. That enrollment ends at the end of December 31st, meaning that if you're interested in enrolling for the month of November and December, you still have a chance to enroll into health coverage. Open enrollment period, it's coming up for the year of 2022, which that window will open in November through December 31st to enroll into health insurance starting January 1st, 2022. And if you already have Cover California, the renewal period has started October 1st. It is ongoing till December 15th, which now is the time to go ahead and make any change within tiers, within plans. And then for Medi-Cal, it's always a year-round open enrollment. Next slide. So if you have any questions or need assistance with enrolling or determining which program you qualify for, you could always give us a call at the 213-241-3840, option 1, and just go ahead and request to speak with a certified enrollment counselor to be connected with someone from the CHAMP program. And our office hours are Monday through Friday, 8 a.m. to 5 p.m. Thank you.
Thank you, Marisela. Next, we want to welcome Jane Salazar, specialist for LAUSD nursing.
Good morning, everyone. Greetings from local district nursing, central nursing. My name is Jane Salazar. I am a school nurse. I want to let you know that every school has access to nursing services. We offer specialized nursing programs like communicable disease and immunization program. The communicable disease control team keeps our schools and communities safe and healthy by preventing the spread of infectious diseases. This group of nurses administers vaccinations on site for students and provides consultation regarding infectious diseases. Another program is an oral health program. Here, nurses work with dental practitioners throughout LAUSD to offer dental care. This program provides resources for oral health education to students, parents, the community, teachers, and staff. We also have audiometric testing program. This provides hearing screenings to all students within the district, including those enrolled in special education. Students with hearing loss are identified and referred for audiometric testing. We believe that children with hearing impairments may not perform well in the classroom if they are not correctly identified and treated. Another program we offer is the Queen's Care Dental and Vision Program. LAUSD Nursing Services, in partnership with Queen's Care and USC School of Dentistry, using mobile units to provide an on-site dental care and follow-up and a comprehensive eye exam. Next slide, please. The state requires immunization for every student to return to school. Immunization helps protect not only individuals, but the whole community as well from infectious diseases. Our school nurses are reaching out to all families to provide resources and to encourage immunization compliance. Students also can be assisted in taking medication during school hours when there is written authorization from their health provider and parent guardian. So if your child needs to take medication at school, please reach out to the school nurses on the school so they can assist you. For students with specialized, requiring a specialized protocols in the school, we will also assist them and we will perform the services as long as we have a doctor's order. And to access the forms for the parents and information, you can go to the nursing website and click parent resources or call the school and ask for the nurse's assistance. Next slide, please. And finally, stay safe at school by wearing a mask, maintaining social distancing when possible, and frequently wash your hands. These measures will help keep us all safe and protected from any infection and diseases. Next, please. If you have any questions or more information, reach out to our local district central nursing specialist, Claire Reed, at this number 213-766-7308. Thank you.
Thank you, Jane, for the information. Very valuable. Our next presenter, we want to invite Gloria Velasquez. She's an organization facilitator representing LAUSD Student Medical Services.
Good morning, everyone, and welcome. Thank you for joining us today. I'm very happy to be here to provide you with some information and resources from Student Medical Services. We work very closely with nursing services and wellness programs. We're very collaborative to try and bring you as many opportunities and resources as possible. I'm with the Office of the Medical Director, which is a new department in LAUSD, and our services are for the preventive opportunities of your students and yourselves. So we offer medical services, dental services, vision services, and mental health services. The locations where this is available is our LAUSD wellness centers, school-based health centers, and we have those throughout the district. Specifically in local district central, we have wellness centers at Jefferson High School, Belmont High School, Santee High School, and Manual Arts High School. I would like to share with you in the chat the link for all of the wellness centers and school-based health centers in the district so that you can have them available to you should you need them. And that will serve as a link for you to know what resources are available to yourselves and your children. At these locations, we have the services of medical, dental, vision, and mental health, including COVID-19 vaccinations, childhood immunizations, and well visits. So being that your children are coming in through the Kinder Readiness program, it's very important for us to encourage you to continue to make sure that your children receive their childhood immunizations and their preventive well visits to make sure that they live a healthy life, right? And that we help support them with that in the district by providing these resources, not only for your children, but for yourselves. The wellness centers that I sent you the link for, including school-based health centers, are available to you, your entire family, and your children. So these are considered what we call medical homes, okay? So in these locations, if you can see the slide here, the main differences between wellness centers and school-based health centers and LAUSD are that at the wellness centers, we partner with federally qualified health centers. So these are professional clinical organizations that bring services onto our campuses by having an agreement with the district. So they provide the services on campus in a facility that is clinical, and they're able to see you and your family. And you can select them as your provider or any other provider, of course, that you choose to select, but you would need to select them in order to receive services at their clinic at the wellness centers, except for currently for COVID-19 vaccines, that is open to whoever needs it at any of the locations. You just need to inquire and call. And this can serve as your home, as your medical home. So you can keep returning and going back to receive care, for example, hypertension, asthma, diabetes, long-term support at the wellness centers. The school-based health centers, we also have some partnerships at some of the school-based health centers, like with the county or with Kaiser and other providers. And we also have staffed clinics with our own LAUSD personnel, our own doctors, nurse practitioners, medical assistants, and nurses that support these school-based health centers that are of no cost. And that is also available to you through the link that I sent you and I shared with the group. So you can access that directly. Keep that link because it's kept up to date. I would also like to share a link because I know that this is very important right now. You may have children that are of age and also family members that may need the resource to know where to go to get a COVID-19 vaccination. So I would like to share that as well in the chat. We do have clinics throughout the district that are providing this service right now. And I'd like to make sure that you have it available. And this is kept up to date as well. We do keep it up to date weekly. We just updated it last night and it should be up to date hopefully by Monday. But it is kept up. So that's a resource for you as well. And we welcome you to continue to reach out to us and feel free to go to the next slide so they can see my contact information. Okay, so this is my office number. We are out in the field a lot, so the best way to connect with me would be via email. And my email is there at the top, gloria.espinosa@lausd.net. If you have any specific questions about medical services, I will be happy to respond to you as soon as I possibly can. But thank you so much.
Thank you, Gloria, for sharing that valuable information. We appreciate it. Next, we're inviting Andrea Moncada. She's the program director for Hands for Hope LA.
Hi, everybody. Hope everyone's finding yourselves well. My name's Andrea Moncada, the program director for Hands for Hope LA. We are a nonprofit organization located in North Hollywood. We are free-based, where we offer after-school programming and also seasonal camps for the winter, spring, and summer breaks, as well as parent workshops and seminars where we invite a variety of organizations to come and present. So we are located in North Hollywood, like I said, but we offer our services to anyone and everyone. They are invited to come and take part into our programming. Next slide, please. So currently, like I said, we are in after-school programming. So we are in session right now in person, and we also offer our services online. I know a lot of families aren't comfortable with going in person, but at the moment we have many classes going on, such as guitar, piano, drums, art, cooking, graphic design, singing. We also have a clay component, and we are in the works of also bringing a coding class. So we have, like I said, a lot of stuff going on, and all our classes are also offered virtually. So if you were to register, we send you a Zoom link, and you are able to join our instructors and our participants online. Our programming is free, and everything is provided, including the equipment and the instruments if your child were to register for an online music class. Next slide, please. So like I said, these are the classes we have currently going on. We are in the works of updating our schedule. We also offer everyday homework help for our kids and a fitness class to get them out and going, since they're cooped up all day at school. So these are some pictures of the stuff that we have going on with our kids. We make every day fun. We are very interactive with our kids, and we are abiding by COVID laws. So everyone is required to wear a mask inside. We are daily doing health screens and questionnaires, as well as constantly washing our hands and hand sanitizing. So we are taking precautions to making sure that the families and the children are safe at all times. Next slide, please. So like I said, before I finish, because it's pretty fast, we have the classes going on, but we also focus with the parents as well. We have a parent workshop coming up October 28th, where we will be inviting a representative from the child support department, and they'll be doing FAQs, answering questions, and helping our families. Along with our parent workshops, we also offer utility help, and we give gift cards. We're going to be raffling off a $150 gift card for Ralph's for the one coming up in October 28th, and everyone is welcome to join. If you want to participate and take part in this upcoming workshop, please email me or call me. My information is found on the slide here, and anyone is welcome. We're just here to help all families, and as well as your children. So yeah, thank you guys.
Thank you, Andrea, for sharing that valuable information. Let's welcome our next presenter, Alejandra Aguilar. She's the program director for East Los Angeles Women's Center.
Thank you so very much, Ricardo. Good morning, everyone. Again, my name is Alejandra Aguilar, and
Buenos días todos. Aquí tenemos a Alejandra Aguilar.
Gracias. I can hear the translation.
Oh, sorry about that. Sarah, can you choose the Spanish side on the bottom? So you make sure you're speaking to the parents that have selected Spanish. Thank you. Okay, let's try again.
Thank you so much. So again, my name is Alejandra Aguilar Avellino, and I represent the East Los Angeles Women's Center. We are an organization that provides services for families.
I don't have the option.
Oh, sorry about that. Okay, we're gonna get this right. Thank you. Miss Yolanda, if you could try translating. Alejandra,
Mhm.
go ahead and continue. Our apologies. We'll work this out. Thank you.
Thank you so much. So the East Los Angeles Women's Center is located in Los Angeles, and the target area is within Los Angeles County. We provide services to families in the city of Los Angeles, Boyle Heights, Lincoln Heights, South LA, Commerce, Bell Gardens. And even though you see some of the cities listed here on the screen, we are able to provide services to people in Los Angeles County. So all of the Los Angeles County. Next slide, please. So these are the services that we provide. We are a crisis center where we provide counseling, therapy, and support for survivors of sexual assault and domestic violence. But in addition to that, we have other services that we provide for families. We have a Promotora program where we train women as promotoras against domestic violence. We have several collectives in Los Angeles County. We also provide services for youth. We have a youth leadership program where youth learn about violence prevention and how to advocate for the prevention of violence. We also provide housing services for survivors of domestic violence, survivors of sexual assault, and human trafficking. We have a shelter. So how we can support you as families is if you are in need of a safe place to be because of violence at home, you need a place to stay, we have a shelter. You are also trying to find safe housing because of domestic violence or issues of sexual assault, please know that you can count on us to be able to assist you in finding a safe place to live. We also provide services for males, for men, for fathers. We have a fatherhood program, and that consists of men's healing circles, where men talk about issues that affect them. It's all with the purpose of having healthier, safer homes. We also have several locations. One location, our main location, is in the East Los Angeles area, but we also have an office at LAC USC Medical Center at the historic Wellness Center. We also provide HIV prevention services for women. Thank you so much. These are the services that we provide. Yes, individual therapy. We provide individual therapy. We provide case management, crisis intervention. And the way it looks like, you can give us a call. If you are ever in a crisis, you are dealing with issues at home, your children are growing up, and you are, as a parent, remembering things that happened to you as a child. If you were hurt, you can always call us. We are available 24/7. You can call, you can vent to us, or you can join a support group. We also provide safety planning. If things are not safe at home because of violence, you can call us and we can assist you with safety planning. We also provide advocacy for survivors of domestic violence, sexual assault, and human trafficking. If there is a sexual assault, we also provide accompaniments to several hospitals within the LA County area. We respond to Whittier Presbyterian Hospital, LAC USC Medical Center, and San Gabriel Hospital when there is a sexual assault. We also provide community outreach. We have promotoras and community educators that provide workshops every month on issues of domestic violence, sexual assault, healthy homes. And we also have the housing program. Thank you so much. Next slide. So our purpose is to help women and their families find esperanza or hope in their lives, and to empower you to attain a better quality of life that is without violence and safe for yourselves and your children. So feel free to call the East Los Angeles Women's Center if you are ever in a crisis or you are in need of parenting classes, you would like to vent and discuss if there's issues of violence. We are here for you. Next slide, please. And one program that I will really like to highlight is our Promotoras Contra la Violencia. Perhaps some of you have seen our Promotoras now with the COVID pandemic. They are also going out in the community and providing, they are providing information about COVID prevention, vaccine awareness, and our Promotoras Contra la Violencia are wonderful women in the community that look to bring awareness on the issues of domestic violence. They connect women to resources to support groups. And we are also would like to provide you with this invitation. If any of you are interested in becoming a Promotora Contra la Violencia of the East Los Angeles Women's Center, give us a call. We will be more than happy to get you on board and train as a Promotora Contra la Violencia. Next slide, please. Again, so these are our goals. You know, our goals is more than anything to be able to assist you if there are issues of violence at home. The main goal, number one goal, is to enhance culturally responsive services, and we utilize an empowerment model to reach monolingual and immigrant Latinas impacted by sexual assault, stalking, dating, and domestic violence. We also have 6 collectives of promotoras. We have a collective of promotora, a collective in the Compton area, the South LA area, the Long Beach area, the East LA area, the Lincoln Heights area, and we are expanding. We also have a collective of promotoras, industry promotoras that are janitors, hotel workers, restaurant workers. And the way that we help you as a parent, if you as a parent are a janitor, if you are working in a restaurant, if you are a street vendor and you are dealing with issues of violence, feel free to give us a call because we have a program that can advocate for you and can assist you. Next slide, please. Next slide. Thank you so much. So here on the screen, there's a couple of phone numbers where you can reach us. So Beba Lopez is our Promotora Institute Director. If anyone is interested in becoming a Promotora Contra la Violencia, please reach out, send an email to Beba Lopez. You can also give us a call at 323-526-5819. That is our main office number. Feel free to ask for Beba Lopez or me, Alejandra Aguilar. But if you are in a crisis, or if you would like to enroll in our parenting classes, if you are court mandated to take parenting classes, if you are looking for safe housing, if you are in domestic violence, there have been any disclosures of sexual assault in your home, please call our crisis hotline. We are available 24/7 and we provide our services in English and in Spanish. The number that you see on the screen, 800-585-6231, has been open and available for the past 45 years. It has never stopped. We have never stopped answering that phone, and we will continue to do so to make sure that you receive the services that are needed. So follow us. We also would like to encourage you to follow us on and connect with us on social media. You can find us at ELAWC. And you can also visit our website. Thank you so very much for participating in this fair and for inviting the East Los Angeles Women's Center to provide resources. Thank you, everyone.
Thank you very much, Alejandra. We appreciate the information. Our next presenter is Malaya Thorpe, and she's representing Violence Intervention Program.
Hi, good morning, everyone. Thank you so much for being here with us today. My name is Malia Thorpe, and I'm one of the clinical directors at our agency. And as you can see, the different services that we have at our agency, we've been providing for over 30 years in our community. We work with different children of all ages, adolescents, and young adults. So we see children from 0 up until the age of 27. We also have the ability to see caregivers at our agency who have children that are enrolled in our services at VIP. And as you can see, we're also in 26 schools in LA County in SPA 4. We also have the fetal alcohol spectrum disorder program that the caregivers are able to attend to get support from working in the groups, working with other parents and working with our facilitators. We also have a more intensive program, which is our outpatient care services, which is 24/7. So if your child is needing services in the evening hours or after hours on the weekend, we do have a phone number that is available that has access to their therapists. Next slide, please. We have a multiple array of different evidence-based practices that our clinicians are trained in that provide support to the children that we provide mental health services. Just to highlight a few, Triple P is a parenting program, which is for parents of elementary age students all the way up to middle school, high school. We also have TFCBT, which is a wonderful component of helping provide support to children and adolescents who have experienced trauma. Next slide, please. The other services that VIP has is case management, where our case managers are able to provide support to families in terms of linking them to food banks, helping them find housing, assisting them in trying to pay their bills with the different organizations that are there to support for electricity, for housing and water. We also do tutoring and mentoring, which is a wonderful service that we do provide for our clients at the agency. Tutoring and mentoring is from 6 years old and up. We also have our LGBTQ clinic, which provides support in terms of medical health services and mental health. Next slide, please. We also have our Los Angeles County Elder Abuse Forensic Center that's attached to our agency. And this is the agency where they do provide case examination, documentation, consultation, and prosecution of any elder or dependent adult abuse cases. Next slide, please. We also provide services to the needs of our foster youth in terms of assisting them in mental health, different support systems, helping them navigate the system that they're in with, oops, sorry. Sorry about that, my mic, in terms of being able to provide that support for them. Next slide, please. We offer a free Food Friday giveaway every Friday at our agency. You do not need to be a client at the agency. It's open to anyone. It is every Friday from 10:30 to 11:30. And it will go to the end of the year as of now. If we do extend it, we will let everyone know. But again, it is open to everyone. So please come down and join us to get your free food distribution. All you have to do is open up your trunk. They place a box in and you guys are able to go. Next slide, please. So we are open Monday through Thursday, 8 to 8 and Friday, 8 to 6. We do provide telehealth services and in-office hours. If you are interested in services, you have our English intake and Spanish intake links that you can just click on and provide your information. And our intake department will get back to you within 24 hours. If you want to have someone to talk to ask more questions, please call the number at the bottom, 323-221-4134. Next slide, please. Again, my name is Malia Thorpe. You can email me at the email address that's listed or contact the number there and ask for myself and they will transfer you to me. Thank you so much.
Thank you, Malia, for sharing. Our next presenter is Wanda Velasquez. She's a mental health therapist representing Aviva.
Hi, everyone. Thank you so much for having me. My name is Wanda Velasquez. I am a mental health therapist and assessor for MAT. Next slide, please. Aviva is a mental health agency. We are a nonprofit agency, and our goal is to provide culturally sensitive and trauma-informed mental health services to meet the mental health needs of children and their families. We do have a birth to 5 program, meaning we are able to see children as young as newborns until adulthood even. So we are able to provide a variety of services for essentially every age of person. We do provide services in Spanish as well as English. Next slide, please. We utilize a variety of evidence-based practices. What this means is that we're able to identify in collaboration with our families what are their needs and match them with an evidence-based practice that will best suit their needs. We provide the programs that we provide are alternatives for families, cognitive behavioral therapy, individualized cognitive behavioral therapy, parent-child interactive therapy, which is a great program for our younger ones and their caregivers. Seeking safety. This is a wonderful program for people who are experiencing crises and need that extra support as needed. We provide trauma-focused cognitive therapy for folks who have experienced a traumatic event in their lives and need that extra support and specific trauma-informed mental health services. Next slide, please. Our programs include various LAUSD on-site mental health services. We do partner with numerous LAUSD schools to deliver mental health services on-site. This is a really important and necessary service to be able to provide on-site, especially right now that children are transitioning back to being in school, and that transition and adjustment. It's wonderful to be able to have our therapists on-site at the schools to meet with children as needed. Next slide, please. Along with mental health services, we do provide medication support services, case management services. These programs are as needed. Our case management program is wonderful. Our case managers are amazing at linking our families with whatever needs they may have. If they are trying to identify a dentist nearby, our case managers are ready with referrals and are connected with our communities to be able to work in partnership with our families and connect them to those types of things. If they need food resources, they're ready. We do have the ability to connect them with food pantries. Our agency is also able to provide as needed that service for our families as well. Our case managers provide active parenting groups wherein they facilitate groups for parents of LAUSD school-aged children where they're exploring different parenting techniques to really attune to their children's emotional needs, behavioral needs, even school needs. Our referrals are in collaboration with other Aviva programs as well. If there is ever a situation where we may need to provide more comprehensive services, we are able to do that and refer to higher level of care as needed. We have programs such as full service partnership and outpatient client services and therapeutic behavioral services to really work in collaboration with our therapists to meet the mental health needs of all of our children and families. Next slide, please. Here is our intake coordinator's information, Kelsey Yakel. She does run the intake program, so all referrals will go through her department. You can email us at intake@aviva.org, or if you prefer to call, you can call us at the number listed here, 213-637-5000. For English, you can dial extension 3753, or for Spanish, you can dial extension 3769. Our hours of operation were available Monday through Friday, generally from 9 to 5 p.m. We do have some flexibility with those hours though, and we can set appointments if we have caregivers who get out of work late and need to speak with someone a little bit later. We can set that up as well. Thank you so much.
Thank you, Wanda, for sharing. We're moving on to our final presentation for today. And we're inviting Reginald, Quinn, and Mariela Joko from Para los Niños and their community ambassadors.
Thank you very much. Thank you for having us. My name is Reginald Quinn. I'm a community ambassador with Para los Niños, Project Innovations, LA. Next slide, please. I also want to introduce my co-worker, who will introduce herself, actually.
Hi, good morning, everyone. I am also a community ambassador. My name is Mariela, and thank you for having us here this morning.
Thank you, Mariela. First, we would like to highlight two services, and the first being the Neighborhood Leadership Group, which is really just a weekly community group sessions that meet virtually through Zoom, and the services that they offer are for families to make connections every week, just to meet virtually and share resource information and build capacity to strengthen leadership skills. They also would like to be in a safe space, and they meet weekly with other community members to share their most immediate concerns. They could range from vaccinations to housing. Their concerns tend to be about mental health these days, about employment opportunities, and also food distributions. And we hold our own food distributions for participants of the weekly groups twice a month at our location. And we also have a feature, which is a virtual office, a brand new feature. And this office is an opportunity for participants in the weekly groups to actually access information, resource information outside of work hours and outside of the weekly groups. If you are participating as a member of the neighborhood leadership groups on a weekly basis, you'll have access to the virtual office anytime you want at your convenience. The neighborhood leadership groups also are provided translations services each week in Spanish, in English, Korean, Tagalog, and Mandarin at this time. And if other languages are requested, we will try our best to make sure that you're accommodated. I'd like to hand it over to Mariela, who will share information about our Connected Family Services.
Thank you, Reggie. Yes, the second service that we offer at Para los Niños is called Playgroups through Project Innovations LA. And what this is child and parent playgroups. And these are facilitated by child development specialists that we have at Para los Niños. And what we do at these groups is we teach the parents how to work with their children through safety, security, empathy, and nurturing. We also teach the parents how to self-regulate and how to build blocks of emotional resiliency. And these happen on a weekly basis, and they are in sessions of 6 weeks. Next one, please. And how these groups work is that every group consists of 3 components, which are observe, reflect, and guidance. And the first one, observe, is the parents are invited to observe how their children are playing or interacting with the child development specialist every time that they meet on a weekly basis. And then the parents are encouraged to reflect on the observations that they have done with their children, or if they observe that their children are having certain behaviors or sleep sleeping behaviors, eating, motor development, or even crying or emotions or separation anxiety. And all of these are encouraged by the child development specialist for the parents to reflect on. And then the parents are guided to play with their children and to practice what they learned during that session throughout the whole week in order to practice with their children. And that is why these are important. And people who participate in the playgroups are also eligible for the food distribution that we hold twice a week. And they're also eligible for the virtual office and for the other resources that we offer within these groups. And next one. If you would like to know more information about the playgroups or the neighborhood leadership groups or how to join, or if there is one in your zip code, currently we are doing everything virtual. You can contact me, Mariela Hucup in Spanish. For my telephone number is 323-679-5814, or you can contact Reginald Quinn for English. His number is also here, 323-496-6903. And for the playgroups, you can contact our child development specialist, Cindy Batres, and her phone number is 323-484-3804. Thank you so much.
Thank you for sharing that wonderful information. We appreciate it. So this actually concludes the end of our community presentations. So again, we want to extend a great big thank you to our community presenters today. And to everyone who's on this webinar, please take advantage of the services that they're offering. Send a message through the Q&A or through the chat to communicate with that organization, or post your question and I'll try to get back to you via email as soon as possible today and answer any other questions that you have. We're going to go into closing remarks, but after closing remarks, please hold on. We're going to share a very valuable resource that will be very valuable to you, your family, community members, and friends. So with that, we want to invite Vivian de la Rosa. She's our wellness coordinator, and she works tirelessly behind the scenes to make sure that we have all these resources available, not only to local district central, but all of our districts in LAUSD. So thank you, Vivian.
Vivian, if you're speaking, you might need to unmute your
I'm sorry,
microphone.
thank you. Thank you so much, everyone, for joining us today. It's so nice to see that there are so many resources available to students, parents, community members. Really, it takes a whole team to provide the resources that our families need, and us at LA Unified as well. We try to focus on the whole child. Just a few reminders that if you go onto the lausd.net website and you click on and you search for wellness programs, then in our department website, you would be able to see additional resources for families. You can click in if you need housing, shelter, food, whatever it is you need. And we've compiled a list of hundreds of organizations, food pantries that can assist you. We also have our hotline that you saw many times throughout the PowerPoint at 213-241-3840. Option 1 is the option for basic needs. Anything that you would need regarding food, shelter, clothing. At times we do have diapers, not all the time. We can help connect you to mental health. If you listen to the whole recording on our hotline, you will see that there is an option for mental health where we do have LA Unified clinicians there to answer questions and to connect you to resources. In addition, if you are not comfortable speaking to anyone in person to tell them your situation or what you need help with, we also have ask.shhs@lausd.net, and you can there do a self-referral. You can refer and ask for help in a number of different options, And then we would get back to you. We have someone looking at those every day, and we would be able to get back to you with the help that you need. Again, please don't hesitate to call our hotline. We are here to help you. And also, I would again like to thank all the presenters, all this wonderful information that we have available for you. This is a great resource, and not all the local districts do this. And so you are very fortunate that your local district is doing this for you and connecting you to resources. So with that, I would again like to thank you for attending today. Thank you.
Thank you, Vivian. And I'm going to pass it on to Christina to share a great resource with us.
Thank you. Thank you so much. So at this time, what we're going to do is one more time, drop the link in the chat box to our resource document. And then I'm also going to ask if Wendy can help us out by sharing the screen so we can show you this wonderful resource document. Going back to what Mr. Andrew Ramirez shared with us this morning, is that there's a lot of information and a lot of people that are here to help you and support your families. So what we'd like you to do is have this that you can take with you after today. And if you at least choose one of these amazing resources to go back to, that would be really wonderful. Everything here is linked live. So you can click on any of these resources and it'll take you directly to their websites. On the websites, you are able to contact, you'll see the hours, the additional information that you can access in each of these. So we have it in English and in Spanish. The other thing is you'll see up above on the very top of the resource document, there are the slides that we used today. When you click that, you can also review all of the information that our presenters shared with you. I know their contact information, phone numbers, hours of service are really important, and that's there for you as well. Okay. So thank you all for your time. We really appreciate you spending your Saturday morning with us. We hope that there's at least one thing that you can take away from today and use to support yourselves, your children, your families. And with that, we wish you a wonderful, wonderful Saturday and a wonderful fall. So and thank you to all of our organization presenters. We appreciate your time today. And we can't thank you enough for sharing your resources with our families and for us as well. So have a good day, everybody. Bye-bye.